Hey guys, welcome back to my channel. If you're new here, my name is Paulina and I'm a resident currently practicing in general medicine. In today's video, we're going to be covering the basics of high blood pressure. So first of all, what is blood pressure? So the human heart is a muscular organ that pumps blood to the rest of the body. And when it pumps, it creates a force against the walls of the artery, and this is what's known as blood pressure. So your blood pressure is made up of two different numbers, and the goal blood pressure is less than 120/80. So when your heart pumps, it creates a force, and that is known as the systolic pressure. And usually we want this to be less than 120 millimeters of mercury. And then when your heart relaxes, that's called your diastolic blood pressure, and we want that to be less than 80 millimeters of mercury. So what is high blood pressure, or as medical people call it, hypertension? So there are two different kinds of high blood pressure. The first one is called primary hypertension, and this is basically your run-of-the-mill hypertension, whereas secondary hypertension is due to some other medical problem that may be going on at the same time. Some examples of this can be like sleep apnea, thyroid problems, kidney problems, medications can also cause it, or if there are any illicit drugs involved can also cause it. In today's video, we'll be covering more of the primary hypertension. So when someone has high blood pressure, the force of the blood exerted in the arteries is way too high. When your arteries experience this strain, they resist the blood flow, causing your blood pressure to rise. And this causes your heart to pump harder. And the arteries are also under greater strain by carrying the blood. So, the American Heart Association and the American College of Cardiologists have published guidelines for defining different levels of high blood pressure. So, like I said, our normal blood pressure is less than 120/80, but once you get your systolic blood pressure above 120, that's defined as elevated blood pressure. In this case, your diastolic blood pressure remains normal below 80. In stage 1 hypertension, the systolic blood pressure can be between 130 and 139, and then the diastolic blood pressure increases to 80 to 89. Moving on to stage 2 hypertension, the systolic blood pressure rises above 140 and the diastolic blood pressure rises above 90. There is also something called hypertensive crisis. This is when the systolic blood pressure increases over 180 and the diastolic blood pressure increases over 120. This is considered an emergency or urgency. And this is not something that we'll cover in detail today, but you should be aware that it is very serious. How is blood pressure measured? There are different ways that you can monitor your blood pressure at home. Your doctor will likely recommend you to get some sort of device to keep track. I also recommend that you have this device cross-checked in the clinic to make sure that those readings are accurate. But some examples are the regular sphygmomanometer. There's also a digital one, and there's also a finger or wrist one. And then the gold standard would be ambulatory blood pressure, where your blood pressure is measured over 24 hours. So what causes high blood pressure? There are certain risk factors that may predispose you to have high blood pressure. One of the more common ones is age. As we age, we naturally have just a higher risk for having blood pressure issues. The second one is you're obese. So if you're obese, your heart has to pump harder to deliver oxygen to the rest of your body. Also, if you are of African descent, you're also most likely to have high blood pressure. If you have a diet that's high in sodium, this can cause your body to retain water and also increase your blood pressure. And then also, the last thing is excessive drinking. This can be very damaging to your heart. What are the signs and symptoms of high blood pressure? One of the big problems with this question is that there often is not a lot of signs and symptoms when you have high blood pressure. That's why it's so important for you to get your blood pressure checked at least once a year. Sometimes though, if the blood pressure is truly very high, some people may present with acute headache, dizziness, changes in vision, nausea, or vomiting. How is high blood pressure diagnosed? First thing is, if you think you have high blood pressure, I really urge you to be consulting with your own doctor. The diagnosis of hypertension can be tricky. It typically requires at least 2 different readings on 2 different clinic visits to officially diagnose someone with high blood pressure. So what happens if you have high blood pressure? If you have high blood pressure that goes unchecked for a long time, this can be very damaging for various organs in your body, including your brain, your heart, your kidneys, your eyes. So, like I said, it's really important for you to be checking every year. The major thing to remember is that high blood pressure is the major culprit in causing heart attacks and strokes. How is high blood pressure treated? So the first line of defense is to really optimize everything in your lifestyle to bring down your blood pressure naturally. This is going to include improving your exercise, modifying your diet, lowering your salt intake, reducing your stress level, quitting smoking or drinking if you do. And if that does not work after a while, then the secondary line of treatment would be to start medication. Again, this is going to be very much tailored to your own situation. So make sure that you talk to your doctor before starting any medications and that you guys are working together to make the best decision for you. One of the main goals about lowering your blood pressure is that we're doing things that are going to be maintainable for you. So we always start with lifestyle to do a least intrusive kind of method, but sometimes we do have to resort to medications. There is a lot of evidence that lowering high blood pressure is beneficial to your health. If you look on the CDC website, you'll see that research has shown that a 12 to 13 millimeter of mercury reduction in systolic blood pressure could reduce the number of strokes by 37%, and it could also reduce coronary heart disease by 21% and overall death from cardiovascular disease by 25%. Because the consequences of high blood pressure are so serious, early detection, treatment, and control are critical. There are some common questions that I get asked about high blood pressure in the office frequently. So one of them is, hey doc, how come my blood pressure is low in the morning but then it's high in the afternoon? So my response to that is that your blood pressure can vary throughout the day in responses to anxiety, stress, consumption of different medications or things in your diet. So it's totally normal for your blood pressure to fluctuate as long as it comes back down to normal. Another reason why blood pressure can fluctuate is for people who have white coat hypertension. So this is when somebody's blood pressure increases when they come to the doctor, and they might feel anxious when they're seeing their white coat. Another concern or complaint that I kind of get is, I don't want to start medication because I don't want to be on it for the rest of my life. And I think that's a common misconception, is that if you have high blood pressure, you'll have to be on medication for the rest of your life. And that's not always true. Sometimes we can help you with medication to get you to a goal, but that doesn't necessarily mean that we'll keep you on that medication forever. It will just have to depend on how your lifestyle is changing at the same time. So I hope that you guys learned today that the best way to treat hypertension is with prevention. So if you like this video, make sure you like, share, and subscribe. I want to make sure that we're creating a community here where we can bring our concerns and questions and all learn from each other and be healthier together. And as always, friends, be good, be safe, and be healthy. Bye now.